Good evening. Welcome to the Buckingham Center for Facial Plastic Surgery video tutorial section. Today we're going to be talking about the middle third of the face, which consists of the lower eyelid and the cheek region. Basically this triangle that extends from the nasolabial fold or the cheek smile fold up to the canthus of the eye. This whole area is what we're going to be talking about today. So the middle third of the face. So what makes the middle third of the face look tired or look aged? And the answer to that question is how long is the lower eyelid? Or when you look at someone's face, where does the cheek end and the lower eyelid begin? And once again, I think in some of our other videos I've said, pick up a magazine, pick up a Vogue and look at some of these young models and really analyze how the middle part of their face looks and why they look youthful. And consistently what you'll see is that the cheek is full and extends all the way up to a distance that's very close to the eyelid margin. The closer that cheek comes to the eyelid margin, the more youthful that junction between the lower eyelid and cheek looks, and it eliminates that dark circle or bag that's underneath the eye. So that's where we really need to go with this, is really shortening the lower eyelid or elevating the cheek so that the lower eyelid appears short. Now, in and amongst that aging process, we can have a couple of different configurations. We can have individuals who the fat from the eye has come forward and formed a convexity or a bubble, which is also then confined by this groove underneath it that's problematic because of cheek fat that's diminished or become depressed in the cheek. Or you can have configurations where the eyelid is actually concave or neutral, but you still have the long appearing lower eyelid because the cheek is not extending up into the eyelid. And that's actually a configuration that can happen from blepharoplasty. So, unfortunately, some blepharoplasties are still performed where fat removal is taking place just in the lower eyelid. So if somebody comes in with just that fat coming forward from the lower eyelid, forming that convexity or bubble, and a procedure is performed where that fat is removed, which improves that convexity, but unfortunately it doesn't do anything to correct the length of the lower eyelid. So you can have a post-surgical distortion where you get improvement, but the eyelids still look tired or long because you still have this trough underneath the lids. So that's what we're really trying to correct when we're dealing with that. Now, in addition to correcting just that groove underneath and affecting the length of the lower eyelid and therefore the youthfulness of the lower eyelid, oftentimes we have volume loss throughout the cheek itself, and some of these lines and hollows that extend under the eye also extend down the cheek, what we call the malar groove. And so what you see is this accumulation of fat just above the smile line or nasolabial fold, followed by a groove, and then basically a hollowed out exposed cheekbone. And so basically when we're rejuvenating this area, what we're trying to do is we're trying to add volume so that instead of having these lines and valleys, we have one nice smooth cheek contour that extends up, covers the cheekbone, and additionally forms a nice shadow, especially in women, that correlates and parallels the jaw angle. So what we want to look at is we want to see this nice full kind of teardrop shaped cheek with a nice little shadow underneath it that parallels the jawbone. So in order to rejuvenate this area, we're really talking about the potential of removing a little fat from the lower eyelid, very conservatively, but removing a little bit in those individuals that have that convexity or fat bubble. Then adding fat to the orbital groove or the area underneath that bubble, which is really more adding the cheek, so adding volume to bring the cheek up, and then adding volume throughout the cheek to rejuvenate that area. Now, we accomplish this in different ways in different people. The best way, the way that I like to accomplish this, is by doing a lower eyelid blepharoplasty if needed. If you don't have any additional fat to remove, then we can eliminate that part. And then by doing what's called an autologous fat transfer. Autologous just means the patient's own tissue versus fat from some other place or some artificial tissue. So the way we accomplish that is by harvesting the patient's living fat cells from some part on the lower body where they have additional fat cells to give. So typically if we can, we'll get that from the abdominal area. If we can't, we go to the thigh area or perhaps the waist roll, one of those areas, and we harvest that fat through a little tiny, about a 4mm incision where we use a cannula or a hollow tube with a syringe to harvest out those living fat cells. And we do that in a very gentle fashion to get those out so that they're alive, so we can have a living graft to put in that area. We then process that in a centrifuge, spin it briefly to separate out the things that we don't want to place and leave us with just the living fat cells in the middle. So If we need to do the lower eyelid blepharoplasty, we typically do that in what's called a transconjunctival fashion, which basically means that we go and make an incision inside the eyelid, so preserving and not making incisions on the outside of the eyelid. And through that we can go down and remove the small fatty pockets that may be contributing to the fullness in the lower eyelid. The fat transfer is then carried out by using a little tiny cannula, again a hollow tube. It's 1.2 millimeters in diameter is the biggest one, and the smallest one is 0.9 millimeters. So if you go pick up a ruler and look at the centimeter side, you'll see that those are very small. So that's placed through just little needle pokes in the lower cheek, where we can transfer fat into those hollows and into those areas of the cheek that we talked about to rejuvenate those areas, to build the cheek up into the lower eyelid, to eliminate that long appearing lower eyelid and make that whole area youthful. At times, there's also some skin on the lower eyelid that needs to be dealt with, and so we'll deal with that by using a chemical peel or potentially a little skin pinch or removal of a little bit of skin just below the lashes. Less commonly do we do the skin pinch, but very commonly we do the chemical peel to tighten it. Now, at times we find patients who either don't want to do a fat transfer or they really don't need to have the whole cheek rejuvenated. They just have the trough under the lid. And they also have enough fat in the lower eyelid that we can use that in what we call a repositioning procedure. And so how that happens is that, again, through either the lower eyelid inside incision or through an incision just below the lash line, we're able to go in and instead of removing fat from the lower eyelid, we'll take that fat and mobilize it or take it out of the area that it's in, create a little pocket underneath, and we're able to tuck that fat down into the pocket to fill in the trough. Once again, the goal being to reduce the convexity of the lower eyelid fat, but add volume to the groove, so basically we are building the cheek up into the lower eyelid so the lower eyelid no longer has this long configuration that appears tired. So, you know, again, I challenge you, pick up a magazine, look at a youthful model, and look and see how short the lower eyelid looks, and compare that. Find a picture of an older person where you'll see the lower eyelid has this groove and has the long appearance to it, and the cheek has all these hills and valleys and just isn't one nice, smooth, built-up contour. And I think you'll appreciate the differences between the youthful cheek lower eyelid complex and an aged cheek lower eyelid complex. And then you can also, of course, look at our photo gallery on our website, and you'll see individuals who, once again, have this aged cheek lower eyelid complex in their preoperative photos, and afterwards I think you'll see the substantial improvement and youthfulness that we can achieve by combining the use of lower eyelid blepharoplasty with either an autologous fat transfer or, in certain indications, a lower eyelid fat repositioning procedure to change that relationship between the lower eyelid and the upper cheek. Hope this has been educational for you. Thanks very much.